welcome back to my YouTube channel. In this video, we will talk about the anatomy of the mandible as well as age-related changes in the mandible. Let's start the video. The mandible or the lower jaw is the largest and the strongest bone of the face. So, if you have any MCQs about that, you can easily mark the mandible for the strongest bone of the face. It developed from the first pharyngeal arch. It has horseshoe-shaped body which lodges the teeth and pair of rami which project upward from the posterior end of the body. The rami provide the attachment to the muscles of the mastication. Now we will talk about the body. Each half of the body has outer and inner surfaces and the upper and the lower borders. The outer surface present the following features. First one is symphysis. Mandible is the line at which the right and the left half of the bone meet each other. It is marked by the faint ridge. Mental protuberance. Mentum is equal to chin. It is a median triangular projecting area in the lower part of the midline. The inferior lateral angle of the protuberance from the mental tubercles. The mental foramen lie below the interval between the premolar teeth. The oblique line is the continuation of the sharp anterior border of the ramus of the mandible. It turns downward and forward toward the mental tubercle. The incisive fossa is a depression that lies just below the incisor teeth. The inner surface presents the following feature. Mylohyoid line is prominent ridge that run obliquely downward and forward from below the third molar tooth to the median area below the genial tubercle. Below the mylohyoid line, the surface is slightly hollowed out to form the submandibular fossa, which lodges the submandibular gland. Above the mylohyoid line, there is a sublingual fossa in which the sublingual gland lies. The posterior surface of the symphysis mandible is marked by the four small elevations called the superior and inferior genial tubercle. The mylohyoid groove present on the ramus extend on the body below the posterior end of mylohyoid line. Now we will talk about the age-related changes in the mandible. So start it with the ossification. When we talk about the ossification, the mandible is the second bone next to the clavicle to ossify in the body. The greater part ossifies that in the membrane. The part ossified in cartilage include the incisive part below the incisor teeth, coronoid and cornohyoid process, and the upper half of the ramus above the level of the mandibular foramen. Each half of the mandible ossify from only one center, which appear at fourth, the 6th week of the intestine life in the mesenchymal sheath of the mecal cartilage near the future mental foramen. Mecus cartilage is the skeletal element of the first pharyngeal arch. At the birth, the mandible consists of two halves connected by the symphysis mandible by fibrous tissue. Bony union take place during the first year of the life. Age-related changes in infants and the children. The two halves of the mandible fuse during the first year of the life. At the birth, the mental foramen open below the sockets for the two deciduous molar teeth near the lower border. This is so because the bone is made up of the only alveolar part with the teeth sockets. Mandibular canal runs near the lower border. The foramen and canal gradually shift upward. The angle is obtuse. It is 140 degree or more because the head is in line with the body. Coronoid process is large and project upward above the level of the condyle. In the adults, the mental foramen open midway between the upper and the lower border because the alveolar and subalveolar part of the bone are equally developed. The mandibular canal runs parallel with the mylohyoid line. The angle reduces about 110 or 120 degree because the ramus become almost vertical. In old age, teeth fall out and the alveolar border is absorbed so that the height of the body is markedly reduced. The mental foramen and the mandibular canal are close to the alveolar border. The angle again becomes obtuse about 140 degree because the ramus is oblique. Structure to the mandible: lymph nodes, parotid, submandibular arteries, maxillary, superficial temporal, mesenteric, alveolar, mylohyoid nerves, lingual, articulotemporal, mesenteric, inferior alveolar, mylohyoid muscles, insertions of temporalis, masseter, medial pterygoid, lateral pterygoid, ligaments of the temporomandibular joints, stylomandibular ligaments, sphenomandibular and pterygomandibular raphe. If you have any query, you can ask in the comment section. Thank you.